Hello everyone, welcome to the channel. In today's video, I am sharing with you all yet one another amazing technique that is used to decrease the spasticity in the upper limb as well as in the lower limb. So let's start with the practical demonstration. The patient is in the supine lying position. Now, the therapist asks patient to perform or do knee and hip flexion in this manner. Now ask patient to do interclasping his hands in this manner or interlace his hands in this manner as the shoulder is flexed in 90-degree position. Now therapist add furthermore flexion of hip in this manner and ask patient to encircle his knee like this. The elbow is in straight position and this position also facilitates the protraction of scapula. Now, while maintaining this position, the patient is asked to flex his neck in this way. Now, another step is what? The patient is asked to flex his neck and trunk in this manner, like he is oscillating his body. This flexion of neck and trunk and back, flexion of neck and trunk and back. Therapist has to assure one thing, that while doing the neck and trunk flexion, the elbow is in the extension too. So the lower limb has to exert pressure towards the hand in like this fashion. So elbow is in the extension, hand are interclasped, hip and knee 90-degree flexion or furthermore than that. Now ask patient to do this oscillating movements, this and this. Now, while patient is in this position, the hip and knee is in flexion. That leads to decrease the extensor synergy in the lower limb, and the patient shoulder, scapula and elbow is extended. Elbow is in extension and scapula is in the protection. So that leads to break the spasticity around the upper limb. So after doing this activity for 1 or 2 minutes, the patient is asked to remove his hand like this and support the hip and knee in this manner. Now patient is asked to hold this position, hold this position, hold this position. Don't let me pull the position. Now back towards the bed slowly and again flex the hip and knee. Hold the position, hold the position, hold the position and come back but slowly and again back. So here you can appreciate I will induce all three type of contraction, eccentric, concentric and isometric of the hip flexors. So by inducing that movement, you can actually break the extensor synergy in the lower limb. Once the therapist feel the patient develop active hip flexor movement to stay in this position, the next step is to do the previous one exercise, rocking exercise, oscillatory exercise with only the hemiplegic leg. So let's say this, for example, he is a right side hemiplegic patient, this side. Now patient is asked to interlace or encircle the hemiplegic knee and start that oscillatory movements. This. The patient is also do this exercise as an home exercise. After the physiotherapy session, relax. So by doing this activity, the therapist may break the spasticity around the upper limb because the scapula is in the protection. Also break the extensor synergy in the lower limb because here the therapist facilitate the hip flexor movement. Or next thing, what can the therapist facilitate is that he can dissociate the trunk with the hip and dissociate the trunk with the shoulder region. So by doing this activity, the whole abnormal tone of the body is reduced and normal synergy pattern can be facilitated by this exercise. So try this technique and let us know your valuable feedback in our comment section. Stay connected with us and thank you.